Hi guys, welcome back to the channel. It's Dr. Roberts with Ultimate Bariatrics. Today I'm going to be talking about the complications and the risks from bariatric surgery. This is probably not the most popular subject, but this is a common question, and a lot of people have some inaccurate views on what the risks of the surgeries are. I think one of the most important things to realize is that everything in surgery, especially elective surgery, risks must be very low. We wouldn't be doing surgeries electively if the risk wasn't low. The risk with bariatric surgery in the past was probably significantly higher than it is now. And there's been a lot of changes over the last 10 or 15 years in bariatric surgery that has significantly reduced complication rates across the board. There's also been a great deal of standardization in facilities where the majority of bariatric surgeries are done, which helps to improve outcomes, minimize risk, and minimize complications. The bariatric surgery modality of laparoscopy, meaning the little incisions, kind of like gallbladder surgery, significantly reduces complications. In the old era of open surgery, where these surgeries were done through a large midline incision, the complication rate was as high as 30%. A lot of patients had ventral hernias after that operation and lots of complications. So I see a lot of patients who maybe had a family member that had a bariatric surgery back in those days and had a bad outcome or had complications, and it's created a large deterrent for them to come and seek out weight loss surgery. And it's really kind of a bad thing because these surgeries are actually quite safe now, and they're very effective, they're very successful, and they really do change people's lives, and there's a lot of patients that really need this. And so I would like to talk a little bit about the risks that we do still see, that we do monitor. The majority of these surgeries are done at facilities that are highly regulated and highly monitored. All of the complications, readmissions, and these kind of things are all tracked and reported. So it would be very unlikely that you would have a surgery at a facility, especially one that's covered by insurance, that would not be monitoring all of these things. So one of the most important things that we worry about, one of the most common complications, which isn't actually common, it's actually quite rare, but is the leak. This is one of the things that a lot of patients are concerned about. This is certainly something that both the physicians as well as the facilities monitor very closely. What a leak is a leak from one of either the connections of the intestines created during the surgery or perhaps a staple line from the sleeve gastrectomy. This is a significant complication. The risk of it is very low. It's less than 1%. And so that's important to know. The other things like bleeding, bowel obstructions, anastomotic complications, blood clots, wound infections, these things are all very low. They do tend to vary to some degree based upon maybe what study it is that you read or what source you're using, but all of these complications are quite low whenever these procedures are done in the right hands and experienced hands and at facilities that are monitored for these kind of complications. The risk of bowel obstruction is very low. These things are very rare. Now that doesn't mean that they can't happen. The risk is still real, but it's low. And so in surgery, we always look at things based on a risk and benefit ratio. I think that's important to know. The risk-benefit ratio is something that we use in surgery to decide if people are good candidates for surgery. The benefit has to highly outweigh the risk, and the risk in these surgeries is very low. Most complications, the risk is around 1%. There's a few things that are maybe slightly higher than that. These things are actually very rare. You look at the benefit, resolution of diabetes anywhere from 60% to 95% depending on which surgery you go with. Successful weight loss as high as 65, 75% depending on which surgery that you have and also what patient category you kind of fall into. You have very high success rates with very low risk, which definitely is in favor of surgical intervention. So I think that these surgeries are very safe and they're very effective. And I wouldn't want any of my patients out there to maybe they heard a bad story or heard of a bad complication, and it's important to know that these kind of things are very rare and the surgeries are very safe. So I hope that helps. I'll see you guys next time.